All right, I have cardiovascular heart disease in women. What is cardiovascular heart disease? Right now, the statistic is that it kills just about over 600,000 people in the United States every year, according to the CDC. The most common cause is atherosclerosis, which is a buildup of plaque. Heart disease is specifically in the coronary arteries around the heart. Arrhythmias are also a part of heart disease. An arrhythmia is an irregular heartbeat. Sudden cardiac arrest or death, which was what Cole was talking about, can occur if the arrhythmia slows the heart down so much that it causes total cessation of heart rhythm. Heart failure is not, like what Danielle was talking about, is not a complete failure. The heart is still pumping, it's just not pumping enough blood to keep the body moving. Heart valve problems are problems with the valves opening and closing tightly. If the valves are not performing the way they should, there could be a backup of blood flow in the heart, which is stenosis, or a regurgitation through the valves. If they're not closed tightly, blood can actually flow backwards. Cardiovascular heart disease affects 1 in every 3 women in the United States, so these women are going to be coming to your cardiac rehab. Risk factors. All of these are the typical risk factors. The ones I have in bold are the more important ones. Any woman over the age of 55 is already at risk for cardiovascular disease. Dyslipidemia, when your LDLs are greater than 130 and your HDLs are less than 40, it puts you at risk. Smoking, like everything else, it can cause heart disease. Diabetes, type 1 and type 2, but because of obesity, high triglycerides, metabolic syndrome, it's more than likely going to be type 2 diabetes. What's different with women is because menopause and the drop in estrogen during menopause is a risk factor for heart disease, as well as pregnancy-related problems such as preeclampsia, which is a high blood pressure during the 3rd trimester. Preeclampsia usually, like the high blood pressure usually stops as the baby is born, but there is a chance that you can keep high blood pressure even after the baby is out of your body. Menopause and heart disease. This is the most important part of the lecture because menopause is is caused from the low estrogen levels, and that causes rise in blood pressure, LDL increase, HDL increase, which are both bad, and triglyceride increase, which is also bad. Estrogen is also important for the arteries to keep them flexible and allow blood flow to flow properly. So with the decrease in estrogen, the artery walls harden and plaque could build up easier. It is important to screen for all the risk factors as well as keep an idea of the women that you're going to be treating if they are entering menopause. They will probably be fatigued and not want to participate in this rehab, but exercise will be the biggest deciding factor to help them recover. These are the symptoms that women usually experience for, if the cardiovascular disease, what's the word I'm looking for, goes on long enough, you'll end up with a heart attack or a stroke. During a heart attack, women usually experience different symptoms than men do, and they don't take them as seriously. The typical one is the pressure around the chest, like an elephant sitting on your chest. That's what everyone seems to associate with a heart attack with. The interesting ones that women experience are the nausea and the cold sweats, as well as the sharp back pain rather than the pain down the left arm, jaw pain, areas other than left arm, heart area. For my first article, I wanted to show how it's important for women to understand the differences in the symptoms. In this study by McSweeney, they studied 115 females that have entered menopause that had experienced myocardial infarction. Out of those women, only 43%, less than half of them reported chest pain, which is the most common associated risk or symptom. Most of the symptoms, over half, were shortness of breath, weaknesses throughout the entire body, and unexplainable fatigue. Prodromal symptoms that existed, there was a latency period where they didn't exist, and then the acute attack, were fatigue, number one, 71%. Sleep disturbances, they didn't really go into exactly what the sleep disturbances were, and shortness of breath. So overall, we can conclude that shortness of breath and fatigue are the two more common symptoms that women will experience. This is the awareness distribution during, in comparison from 1997 to 2012 from that same study. There was a large increase, or a large decrease, not a large decrease, an average decrease of association of chest pain, because that's not going to be what women are going to experience. They're going to experience the nausea, the shortness of breath, and from that time period, more people were made aware that it's not just chest pain. Prevention, healthy lifestyle, as always. The biggest, but like, what does a healthy lifestyle mean? It doesn't just mean eating right and staying healthy. Being aware of your body and being aware of changes is really important for women in all aspects, and understanding that back pain, if it's not like what you typically experience, could be a bigger problem than it is. Increasing awareness of symptoms with just education on maintaining healthy lifestyles. These are all important prevention aspects. Diagnosis, like everyone else today, I think, talked about how to diagnose these problems. They're very similar: cardiovascular stress tests, like we do here in the lab, an electrocardiogram, an ECG, an echocardiogram where they use ultrasound to get a 3D picture of the heart, an X-ray, blood tests to test for the cholesterol levels, triglycerides, as well as estrogen levels. Coronary angiography, angiography. If they have suspected so far throughout those tests that the woman does have cardiovascular disease, they will order an angiography, which is a dye inserted to the arteries of the heart, and then you take a special X-ray to see if there's any blockages or if there's any lack of blood flow. The catheter is inserted in the lower leg in the picture, and it weaves its way up to the heart where the dye is injected. Treatment, as always, change of lifestyle. Stop smoking. This is the biggest thing that you could do. You can drop your chances of getting cardiovascular disease or having a heart attack or stroke by 50% just by stopping smoking. Decreasing your weight, eating healthy, being more aware of your body, getting active, and if they already have diagnosed cardiovascular disease, get into cardiac rehab. The next step would be medicinal therapy to lower the LDLs that are associated with menopause and to lower blood pressure. Blood thinners can be used if they are having blockage issues to help get around the blockage, as well as to prevent blood clots. The final step, if none of those things work and they're still having problems, is surgery, which is an angioplasty, which is cleaning out the blood vessel that's blocked, or a coronary bypass is where they go in and take out that artery and put a new one in or put one in around it to bypass the clot. So why was estrogen? If estrogen is the problem, why was it not part of the treatment? In this article that I found, 2,700 women were diagnosed with cardiovascular disease. These women did not have a heart attack or stroke at this present time. They were hoping to see if hormone supplementation could decrease the chances of a heart attack or stroke, if the estrogen would help raise high density and lower low density cholesterol. The age range of these women were menopausal at 66. They looked at the outcome. Basically, they looked to see how many women after the control group and the estrogen group compared to see how many of each group had a heart attack or stroke, and whether it was fatal or non-fatal. Although the hormonal group did decrease LDLs and increase HDLs, they do not recommend this study because it did increase blood pressure and it did not seem to help with the cardiovascular problem. Increasing estrogen seemed a little contraindicative due to the study. those are my references.